And it's also good to be here with Minister Dix and Dr. Bonnie Henry to talk about the next steps our province is taking as we prepare for the fall and winter pandemic preparedness plan. Healthcare, of course, and a strong public health response to COVID-19 has been foundational in our province's recovery. And we're preparing for the challenges that the influenza season will bring to an already challenging pandemic situation. Obviously, COVID-19 is still with us. Our plan has been working, but we need to intensify our activities as we come into the cold and flu season. We still have to keep washing our hands. We still have to focus on physical distancing. If you can't physical distance, please wear a mask. And of course, if you're sick, stay home. Our government has been fighting COVID-19 with a variety of mechanisms. Testing has been increasing up to 6,000 tests a day. Contact tracers have been hired. More contact tracers are coming. And of course, we're making sure that those who need care get it. Today's announcement focuses on that very issue. To prepare for the fall and winter, we are investing $1.6 billion into our healthcare system. This will mean 7,000 jobs for healthcare support workers in long-term care and assisted living facilities, a significant expansion of the province's flu immunization plan, as well as the launch of a new program, which is particularly exciting, the Hospital at Home program, to reduce the chance of transmission in our acute care facilities. Of course, a key element of this plan is the Health Care Access Program, which provides a path for people without health care experience to get on-the-job training. And that means, of course, good news for those in the hospitality sector and other parts of British Columbia's economy that have been affected by COVID-19. These are opportunities for 7,000 good-paying jobs that focus on our common goal to keep people healthy, to keep them well through the pandemic. We also, of course, will be focusing on the influenza season. 450,000 additional doses of flu vaccine have been procured by the province to bring the total available to 2 million, and 45,000 high-dose flu vaccines available for those vulnerable populations in assisted living and long-term care facilities. All of these measures are important to protect our seniors, the most vulnerable people in our populations. I want to talk a little bit about, before I pass the microphone on to Dr. Henry and Minister Dix, about the Hospital at Home program, because this is particularly exciting and new to British Columbia. And the approach, of course, is to make sure that eligible patients can get the care they need outside of an acute care facility and ensuring that, of course, they can get that care in their own home. For many patients, especially elderly, this means that they will be able to avoid complications that oftentimes emerge in our acute care facilities. Hospitals at home reduce pressure on hospitals, and of course it's critically important as we go into the flu season that we make sure that our hospitals are not congested when they don't have to be. Hospital at Home will start here in Victoria at the Victoria General Hospital, and then over the coming months roll out to other acute care facilities and communities across British Columbia. This, of course, is a major step forward as we come into the fall. Our pandemic plan has been working. We need to accelerate and we need to up our game, not just in the delivery of services, but citizens across British Columbia. Dr. Henry and Minister Dix yesterday spoke about new health orders to get that caseload down to manageable numbers. And I again appeal to all British Columbians to follow the directives that have been put in place. It's in the best interest of our people. It's in the best interest of our economy. And if we are going to continue to lead the country in fighting COVID-19, we have to get back to that ethic that got us to that enviable position by working together, by focusing on the directives that will make sure that all British Columbians are safe during this most challenging of times. Of course, we're going to be seeing kids returning to classrooms tomorrow. I'm particularly excited about that, but I do know that there are parents and others in the system that are particularly anxious. I want everyone to know in British Columbia that we will do everything we can to keep people safe, not just in our schools, but in every facet of our endeavors, whether it's in the economy, whether it's in social gatherings, whether it's in critical institutions like our hospitals, our long-term care facilities, and our schools. And with that, I'll invite Dr. Henry and Minister Dix to go into the details of our pandemic preparedness plan for the fall. And I think I start with Minister Dix or Dr. Henry? Dr. Henry.
Thank you very much and good afternoon. So as you know, as we managed to move into our restart plan over the summer, we have had increased numbers of cases of COVID-19. This is something that we have expected. We knew that as we took those all-important steps of restarting our social connections, our economy, that we were going to see more cases, and we have focused on making sure that we could manage and that we could do the contact tracing we needed to keep the transmission chains low. But as we move into this next phase of our pandemic in the fall, where we know to have respiratory infections. We know the impact that that has had historically on our healthcare system, in particular on long-term care homes and on our hospitals. So we need to increase the work that we're doing, and we need to be prepared for what might come next in this next phase. The foundation of the plan is the need for a strong and ongoing focus on sustaining the infection prevention and control measures that we have in place across our system, whether it's in the community, the work that we're doing with public health, in long-term care, in hospitals. And we also have a focus on a number of other key areas that we've heard the Premier mention. So strengthening public health, strengthening our protection of vulnerable seniors and elders in our communities, and people at risk, and ensuring that our healthcare system is ready to respond as we need. To start off with, I'm going to talk a little bit about what this means for our public health capacity. We will be increasing our testing capacity to be able to manage both testing for influenza as well as COVID as we move into the respiratory virus season. And that means our capacity of about 20,000 tests per day. This is a challenge. It's a challenge in a whole variety of ways, not the least of which there's a global shortage on some of the reagents that we need for the equipment that we have here. But we have started on these plans when this first all arose in March, and we have systems in place. We're working with our colleagues across the country to make sure that we have in Canada what we need to do this, and we're well on our way to get there. We also are looking at increasing the resources that we have with our public health teams across the province for the important measures of contact tracing. As you know, every single case of COVID-19 is followed up by public health in this province, and part of our role is making sure we can identify those people who have been exposed and are at risk of developing symptoms, so we can support them to isolate, to stay away from others, so if and when they do develop symptoms, one, they can get the support they need, but also they're not passing it on to others. That is very labor intensive, and for the 3,000 and some people right now who are in isolation and being monitored by public health, you know what I'm talking about. But it also is really important that we have that human connection to be able to do that, to answer your specific questions about what it means for you in your situation. We'll also, of course, be looking at whether we can have things like the CAN app help us with that. But right now, the important functions are being done by real people who understand the issues. And we've announced already that we'll be hiring 500 new contact tracers, but we have had an overwhelmingly positive response to that. And we've now increased that number to 600 people, some of whom have been hired already and will be working around the province to support this incredibly important function. As well, one of the important things that we need to do is everything we can to protect ourselves and those at risk from influenza this season. So our fall influenza campaign is going to be on a scale that we have not yet seen to further protect people who are vulnerable in this province. And we encourage everybody who's over the age of 6 months to be immunized for influenza. And we'll be looking at how we can provide influenza immunization in settings in communities, in physicians' offices, through pharmacists, in our healthcare sector, and through public health clinics around the province. And we've been working on those plans. We've increased the number of vaccines that we have available, including some of the vaccines that work specifically in our elders and seniors. That's the high-dose flu zone vaccine. So these are going to be made available. And in addition, we've bought the an increased amount of vaccine that we've ever had in the province. we have been looking at what has happened with influenza in the southern hemisphere. As we know, influenza circulates in the northern hemisphere, generally starts in October, November, and peaks around in December and January. And in the southern hemisphere, they have just seen the peak of their influenza season. So the good news that we've seen out of the southern hemisphere is that their immunization rates were very high. And this is one of the things that we recognized early and have triggered us to purchase more vaccine here, because we know how important it is to protect us all from influenza. The other things that we've seen in the southern hemisphere are that the measures we've put in place to deal with COVID also help protect us from those other respiratory infections. So we need to continue doing the things that we're doing, like washing our hands regularly, covering our mouths when we cough, staying home when we're sick. And right now, it's going to be incredibly important for all of us to protect ourselves, our families, and the communities by getting immunized for influenza as well. The other thing that does is help reduce the impact on our healthcare system, because we know that when people are infected by influenza, particularly we know influenza makes younger people and older people more severely ill and can lead to hospitalization, both from the infection, but also because influenza can exacerbate some of those other conditions we have. So that is going to be incredibly important for us in the coming weeks and months. And I will turn it over to Minister Dix to talk to you about some of the other issues.
Thank you very much, Dr. Henry. And I'm just going to move the slide around. Let's see if I'm going to do this right. There we go. As part of our plan that we've prepared for the fall and into the spring, obviously, a key aspect of that we've seen from the beginning of the COVID-19 pandemic is the need to protect vulnerable seniors. So as the Premier has announced, we're ensuring robust infection prevention and control practices across all assisted living and long-term care facilities, with funding to hire up to additional 2,000 staff for that purpose. Major recruitment and training strategy as well. There will be put in place for the additional healthcare aides, cleaning and food services staff across long-term care sector, up to 5,000 new staff to add additional capacity. This brings us up to a total of 7,000 additional staff in assisted living and long-term care homes. This is, of course, to address the needs of the COVID-19 pandemic, but also as we continue to aspire to raise care standards, which is the plan that has been in place since 2017. In addition to that, as part of the immunization plan presented by Dr. Henry, flu zone high-dose immunizations will be available to all residents of long-term care and assisted living facilities as part of that plan. This is support provided by the federal government. It's about 47,000 doses of the 1.965 million doses that we're presenting across BC, and we're very appreciative for their support. An example of our protecting vulnerable seniors, of course, is the $44.1 million that we're putting in place to recruit the estimated 7,000 healthcare worker positions. The program that we're putting in place will provide a path for interested applicants to receive formal, on-the-job, modular training. New hires in the program start in a healthcare support worker position and receive paid training that leads to full qualifications as a healthcare assistant. We'll move this along. You see, I got to get better at this clearly.
Run the machine.
You want to run the machine? Can you run the machine?
There is a little delay.
When I was in high school, I don't know if I can.
Yeah, see, we're having. We're going backwards. Okay, we're going to see where we are here. I'm looking at the wrong thing clearly. And so this campaign is open to all interested individuals, but it will also specifically target people who have lost their jobs due to the COVID-19 pandemic, in particular people previously employed in the hospitality and service industry. The starting salary for healthcare support workers is approximately $20 an hour, with fully qualified healthcare assistants earning approximately $23 an hour. For more information on the Health Career Access Program, you can visit the Government of British Columbia website, that's gov.bc.ca, and search Health Career Access Program. We're also, in addition to those efforts in terms of seniors care, in terms of long-term care, in terms of assisted living, we're also strengthening primary and medical specialist care for at-risk patients. We're developing patient care guidelines and best practices for COVID-19 patients, including rapid referral pathways to a higher level of care as required. And you've seen these in action, and in particular in the outstanding results we've had in British Columbia for those who have been hospitalized and those who have been in critical care. We're also developing patient care clinical guidelines and increase access to virtual care for older patients and or individuals more likely to experience a serious form of the illness due to an underlying chronic medical condition, cardiac, diabetes, renal, respiratory cancer, a compromised immune system. We're planning, of course, to position and to continue to position urgent and primary care centers. We announced our 19th in West Kelowna yesterday, and other designated primary care clinics as acute respiratory illness centers for the coming fall, winter, flu, and COVID-19 season as required. And I want to say to all those who've worked in the urgent and primary care centers what a central role they played in March and April and in May. They have provided outstanding service up to now. It's been, I think, an excellent initiative up to now, but they have absolutely proven their weight in gold during the COVID-19 pandemic. I want to go on to the next. See, I got to keep going on to the next page. We got to implement, we're continuing to implement the patient transport and access to care in rural remote areas, the plan that was announced by the Premier on April the 20th, and it continues to be put in place across communities. The important fact to deal with transmission if it occurs in rural and remote areas, to be able to bring people to acute care as required and provide supports in those communities is a crucial aspect of our plan and central to building confidence throughout British Columbia, not just in urban areas. We're also preparing for increased inpatient hospital demand. You saw in March, at the end of March, when we presented our plan for hospitals based on modeling at that time, that we were presenting and developing this plan against what had happened in Hubei province in China, what had happened in Italy at that time. That's how we presented our plan and some of the dramatic measures we put in place. And as we've done in that, we've mapped out inpatient hospital bed supply against likely demand. But this time, of course, is based on our own experience. Hospital occupancy from 2019, based on fall-winter months, including the effect of a typical influenza season, where there are more respiratory admissions. And addressing, of course, the continued increase in surgical demand based on our surgical program that has been put in place is obviously part of this plan. And you can see that in detail. Members of the public and members of the media can see the 50-page PowerPoint presentation where we lay these scenarios out in detail, and the 60-page plan that presents our plan in detail that will be available on the Government of British Columbia website for everyone to see. We're preparing for 4 potential scenarios. A low COVID-19 case scenario. This measures the situation in June with low numbers of daily new cases and admissions, representing a minimal number of COVID-19 beds required among a limited set number of sites. So this would be ICU 25, acute care 57. That's the low scenario. Just to put this in context, our current situation is 12 people in ICU and 32 in acute care hospitals as a whole. The second scenario is a moderate one, increasing transmission resulting in a moderate number of COVID-19 cases and admissions. This would be ICU 55 and acute care 98. We have a scenario to deal with high COVID-19 cases, ICU 108 and acute care 201 occupancy. Just to put that in context, we are planning for above what we saw in the spring under that scenario to ensure that we're ready should that happen. In the spring, those numbers were 72 at the height in critical care on April 5th and 149 in hospital. And we are preparing for planning purposes. We don't see this happening, but for planning purposes, a very high COVID-19 case scenario that would include 214 in ICU and 400 in acute care capacity. And so what are we doing? What are we putting in place for that? You see that in the following page. It's obviously robust infection prevention and control practices across hospital site, including for individuals. We're implementing a number of management strategies, from operationalizing surge bed capacities for early fall to meet routine increased surgical bed and COVID-19 demand for scenarios 1 to 3, and develop a contingency plan for scenario 4. We're establishing emergency department COVID-19 and routine pathways, both for respiratory and non-respiratory. We're maintaining restricted visitor policies. implementing COVID-19 cohorted wards and ensuring isolation capacity, and continuing critical care and ventilator management strategies for ICU and acuity units. And we're prototyping, as the Premier has mentioned, a hospital-at-home model and other acute care management strategies to reduce inpatient medical bed demand. Our ongoing focus is on building, strengthening, and planning health human resource capacity across our hospitals. And just to speak more specifically to the hospital-at-home model, this is to reduce the chance of patients being exposed to COVID-19 in BC's hospitals. We're dedicating $42.32 million to the launch of Hospital at Home, an innovative program which has seen success in other jurisdictions around the world. Through Hospital at Home, admitted patients who meet the criteria will be offered 24/7 care at home rather than staying in a hospital, but remain under the direct care of the hospital. Hospital at Home will first launch through the Victoria General Hospital and then through other additional health authorities, including in the north, and hospitals over the coming months. I want to just move on to say that obviously I report weekly on access to personal protective equipment, and yesterday, and you see some of the numbers of what we have brought to British Columbia since March, over 6,300,000 N95 or equivalent respirators, almost 50 million surgical or procedure masks, over 2.6 million pieces of eye protection, over 90 million pairs of gloves. This was as of August 31st. Last week, as you know, 25 million pairs of gloves came into British Columbia and almost 8 million gowns. We presented information, just so you know, on July 27th, and I refer you back to that, about what our volume targets are for the next 6 to 9 months. At that time, they were 58.1 procedure and surgical masks, 6 million additional N95 or equivalent respirators, 349.71 million gloves, and 2.4 million gowns. And just to bring you up to date on the costs, in July, I reported that over $114 million had been spent on PPE from January to the end of June. Today, I can tell you that through August, that number is $136 million. So just to speak briefly to the budget impact of all of this, the Ministry of Health has received an operating budget increase of $1.6 billion and a capital budget increase of $150 million for 2020-2021 to respond to the healthcare requirements of COVID-19. This includes $374 million for public health measures, $416.6 million for community and long-term care measures, $783.9 million for recovery and increased health capacity, $150 million for renovations and equipment to support the healthcare system to respond to COVID-19. This includes approximately $850 million for a number of initiatives already announced. Those include increased contact tracing staff announced by the Premier a couple of weeks ago, the enhanced rural remote transportation framework, the single site staffing initiative, which is $165.4 million, the surgical renewal plan, and increased spending for personal protective equipment. So to summarize, with nearly $1.6 billion in additional funding and a comprehensive set of actions now underway, the BC health system is well placed to meet the demand with the backstop of knowing that we can successfully implement more extreme hospital access control measures if they are required. With a planned surge capacity in place, it will be less likely that we will need to reduce access to services. And this is the plan, to learn and to learn again from what we did in March, and to only use the measures we need to use to ensure that we can deal with COVID-19 and continue to allow the healthcare system to operate through all the other things that it has to address in a given day, week, month, or year. Focus on continuing to build out needed health human resources, and you see that the hiring, training, and effective deployment of staff remains a priority. Hospital planning is focused on 19 COVID-19 sites, with remaining hospital sites dealing with a small number of local cases. This approach is supported by work underway to ensure responsive patient transportation and support service in rural areas of the province. We're taking a range of additional measures to strengthen our capacity to manage COVID-19 and reduce normal historical demand on inpatient medical beds through the fall-winter of 2020-21. Notwithstanding these actions, there's an ongoing need for all of us to sustain the infection prevention and control measures across commercial, work, and social settings. It's up to all of us. This is a response, a comprehensive response for the healthcare system. Our healthcare workers, our healthcare professionals have done extraordinary things in the past months, but so have the people of BC. And for us to succeed, to succeed in delivering not just the surgeries we do in a normal year, but more. To succeed in delivering better primary care. And to do so in the context of a pandemic means that all of us have to continue to be all in our effort to fight COVID-19. This plan is a plan for the health system, but really it's a plan for all of us. I'm very proud of the work done by the officials of the Ministry of Health. You'll know that the changes in the plan that we put in March, that the Premier announced at that time, was made in a very rapid way, based on what we knew in other jurisdictions. We had not had the experience in British Columbia. The work here has involved months of planning by health authorities and led by Dr. Henry and our Deputy Minister, Stephen Brown. It reflects, I think, the extraordinary commitment of the Premier to a public healthcare system that meets the needs of British Columbians at a time when their needs are highest, during a time of two public health emergencies, both the overdose crisis and the COVID-19 public health emergency.